Now, psychiatric services for pregnant women and new mums have told the BBC they're concerned that some patients are turning down specialist care because of strict COVID-19 restrictions. Mother and baby units brought in measures to prevent the virus spreading on the wards, including isolation periods for new arrivals and dramatically reduced visiting, meaning some mums have been more reluctant to accept help. NHS England says its 19 units treat around 800 women a year, and people should seek help if they need it. Anna Collinson has been granted rare access to one unit in Nottingham.
Becoming a mum can be the happiest time of someone's life. But for a small group of women who experience serious psychological problems, places like this are a lifeline.
They may be actively suicidal and absolutely want to die. There may be times where they may have thoughts to harm their baby.
Clinicians say separating a mum and baby can affect their relationship, so they focus on keeping them together while the mother receives psychiatric treatment. But in a time of upheaval, building trust is harder than ever. Due to coronavirus restrictions, Catherine went through 13 hours of labour without her husband. She believes this triggered her postpartum psychosis symptoms just days later.
I had hallucinations and delusions. I had urges to do things that I would never normally want to do. I ended up actually reliving my birth at one point, which again was very traumatic. And there were times where I thought that actually myself and Ollie didn't actually survive labour.
Catherine was admitted to the Margaret Oates Mother and Baby Unit in Nottingham.
If you want to come this way, I'll just show you to a patient bedroom.
New patients must isolate in their rooms until a coronavirus test gives them the all clear.
It can be really, really difficult for some mums just being in these four walls with, their baby. And it can be, that ladies don't particularly want to come into hospital because they're going to have to isolate for the first 24 hours.
While patients isolate, the only contact they have are with staff dressed in full protective equipment.
For our women that are acutely unwell, they're often quite frightened, and then we're wearing all of this kit. They can't see our facial expressions. We try as best we can to express compassion and kindness through our eyebrows, but we are fairly limited.
So it's been a difficult night on the unit. A woman was admitted last night. She was acutely unwell and she had to be restrained by staff. And we've been told incidents like this can have a ripple effect and cause further distress to other patients. After a drop in demand during lockdown, NHS England says admissions for mother and baby units are now close to pre-COVID-19 levels. Strict measures like reduced visiting are in place to protect an already vulnerable community. But they're putting some women off. There are women who've turned down psychiatric care because of COVID restrictions. Are you concerned about those women?
Yes, the lack of community services or face-to-face community services can have an impact. Early intervention is really important. It stops anything lingering.
A month after leaving the unit, Catherine has come to thank those who helped her. Aside from a few visits, husband Chris had to miss the first weeks of his son's life.
At the start, there were obviously concerns. I didn't understand the illness fully. It's really good to have them home. It's sort of nice. I know it's not over, but the worst bit is, and now we're just on just trying to get back to normality really as much as you can. Yeah.
Anna Collinson, BBC News.
Let's talk now to Elizabeth Sankey, who was a patient during lockdown at the East London Mother and Baby Unit. Also with us, Ella Baker, a clinical nurse manager from the same unit. Thank you, both of you, for talking to us. Elizabeth, can you give us an insight into how you were feeling each day when you woke up after your son was born?
Yes, so I would say almost only like 3 days before he was born. 3 days after he was born, I started experiencing severe anxiety with just kind of adrenaline coursing through my body every morning when I woke up, and it was horrific. And my husband and I just had no idea what was happening. And it wasn't until we talked to a midwife. I was planning on having a home birth, so we had these incredible home birth midwives. One of them said to me, you need to go to A&E because I think you need a mental health assessment. So we did that. And then what followed was a month of me trying to get help, me trying to understand what was happening to me being terrified that, I was going to feel like this forever. And I would hear things about mother and baby units when I would go to A&E because I was feeling suicidal. But it always felt like it was something that was out of reach. And also I was doing all of this on my own because of COVID. So my husband couldn't come with me to hospital when I had to have these psych evaluations and things like that. So it was all very, very difficult.
I'm sure. You were diagnosed with severe postpartum anxiety. How did the unit help you?
It was incredible. When we finally got into one, we were so thrilled to get into the East London unit because the COVID restrictions were a lot less severe. So my husband could come every day and see me, whereas at some mother and baby units at the moment, families can only meet like once or twice a week, which I think is really, really tough. It was really scary. It's obviously incredibly scary to be hospitalized for a mental illness, and I'd never had anything like that before. But I knew that I was going to get better. It was the first time since the illness had started that I felt relief because I just knew I was going to get better, and my husband was so relieved as well. And that's the incredible thing about, well, not incredible, but this sort of silver lining to the grey cloud that is mental health issues around pregnancy and birth, is that it's really, really treatable, but only if women get help.
Of course. Let me bring in Ella then, who does help people like yourself, Elizabeth. Ella, good morning. What impact has coronavirus had on the help you're able to give to mums like Elizabeth?
I think the help, obviously we didn't stop admitting mums throughout the whole of the pandemic, but the isolation period at the beginning had a big impact, I think, on new mums' anxieties, especially if you're already suffering from a mental illness and then being told to stay in your room. And especially with a baby, I think it's very difficult. As previously mentioned, the no face-to-face assessments, the lack of kind of perinatal community access prior to coming into a mother and baby unit, I think had a big impact on the mums. So luckily, Elizabeth had a bed with us, and other mums continued to get beds, but there are only 19 units in the UK.
Sure. But actually, what we're reporting today is that some new mums have turned down going into mother and baby units because of the restrictions in place. Now, that must be a concern for somebody like yourself.
It is a concern, and hopefully women who see this today will realise that, you can still get the help, you can still come into hospital. The restrictions they're there, but they're there for a reason, to keep everybody safe, and you can still have visitors. In most mother and baby units, the restrictions are there for a reason, but we're human. We understand that dads, partners want to see their new babies, etc. So
yeah. Elizabeth, what would you say to anybody who is a new mum or coming to the end, about to give birth and is feeling anxious? What would your message be to them?
Just tell people how you're feeling. I think it's so difficult, as Ella was saying, with the lack of face-to-face, and also in your report as well, that it's very difficult to convey sometimes how terrible you're feeling. And I think so many women want to cope, and especially with when you've just given birth, you want everything to be wonderful, and you don't want you feel so ashamed if you don't feel like that all the time. But there's sort of things that you can do to get help, and as I say, it is so treatable. So yeah, talk to people, talk to your GP, be honest about how you're feeling, and reach out to other women as well, because one of the things that helped me so much was talking to other women who'd been there, who'd been in MBUs or had mental health issues around sort of the perinatal period. So yeah, just ask for help, and also contact me on Twitter. My DMs are always open.
And what are you on Twitter, Elizabeth?
I'm Sankles, Sankles.
Okay. Thank you so much for that. Thank you very much, Elizabeth. It's good to talk to you. Ella, thank you for your time. Really appreciate it. Ella Baker, who is a clinical nurse manager for the East London Mother and Baby Unit.